My name is Jessica Moreau. I'm a medical anthropologist and a qualitative researcher at CSHP. I went to grad school for anthropology with every intention of becoming an academic anthropologist. I was trying to understand from a systemic perspective how women got their health care, what kind of system they were working in. And I started to think about that what I was learning could be helpful, could be interesting, more than just beyond the academic realm, that maybe this could even be helpful information to healthcare systems. So I went to UCLA and I spent a year there. At UCLA, I worked with Jack Needleman, and he listened to kind of where I was at, and I didn't really know the next step. And he said, "You need to meet my friend, Becky Yano." So I thought I was doing an informational interview. And so I sat down with Becky, and it took about 10 minutes before I realized she was interviewing me. So I joined CSHP to help bolster the qualitative side of things there. There was a survey that was done that was asking women veterans about experiences of public harassment while they're at the VA, and it came up with this pretty shocking finding, actually, that something like 25% of women veterans reported being harassed at VA. So this sparked a lot of action. All of the work so far about harassment and also about welcome comes right now in the form of surveys. This was the first documented solid finding that we could point to and say, yes, this is definitely a problem. So I got really interested not just in the harassment side of things, but in this idea of welcome. Obviously, experiencing harassment could have a very big impact on how welcome someone would feel in a healthcare setting. Comfort level, welcome, these are really internal things. They can be hard to study. They can even be hard to talk about because they are so felt. They're so visceral. So this is where I think qualitative research really has a chance to shine, because what we do with qualitative research is we can get behind those survey findings. So now we have the surveys, we know this is a problem, so now we need to understand why and how is this happening. Qualitative research has an ability to get at values, has an ability to get at what motivates people and explain the context that fills out the bigger picture than, say, just that one measure on a survey or even just an open-ended question at the end of the survey. For being such a hard thing to talk about, welcome, that we know has a huge impact. Women veterans not feeling welcome is associated with unmet health care need. It's associated with reliance on non-VA care, and it's associated with attrition from VA care altogether. So for being such a feeling, how do you study a feeling? We know this feeling has tremendous impact. What I love about working in VA is the tight connection between the research we do and the application of where that research actually hits the road. That kind of work is not available in many places. If you work for a think tank, something like that, I was told you do this great work and you throw it over a fence, and you hope someone picks it up on the other side of that fence. But with VA, you do this great work and then you get to watch it happen. So one of the most inspiring parts of my job is my direct contact with women veterans, especially, usually in the form of an interview. I am just so struck by the kind of privilege and honor it is for these women to share their stories with me, to sit with me on the phone and just be there to hear about their challenges, their triumphs, everything they've experienced, how this all fits in with their lives. Because it's not just healthcare. It's everything. It's their relationships and their kids and their job and how it all fits together. So I always get off the phone from an interview with women veteran, usually just feeling really excited really inspired, and just really, really lucky. If these women were not, willing to share their time with us, their stories with us, this research could not happen. And we need to hear their stories in order for this research to have the most possible impact and to really know what it's like to tailor a system to a group of people's needs.